camera. Okay. If she laid down in
Okay, then that's fine.
yeah. Okay, hi guys, this is Alice. We're so happy to have Melissa here today with us. She's specialized in women's health, and we're going to talk about what it is and why is it different from outpatient ortho physical therapy today. So we're very happy to have you today.
Thank you for having me.
Yeah. Oh no.
And this is my cat Tess. She'll be in and out.
That's so cute. You've been having your internship in both outpatient and women's health, right?
Right, so my last year long was 6 months of ortho and then 6 months of women's health. So women's health physical therapy is a specialty within physical therapy that focuses on pelvic floor dysfunction. So commonly we see urinary incontinence, urgency, we see pelvic pain, sexual dysfunction, and constipation commonly.
And then you just mentioned that you see both women and men.
Men and
Even
women,
though-
yeah. Yep,
Okay.
yep, we see everyone.
So why does women's health physical therapy different from outpatient orthopedic physical therapy?
So it's largely the same, but for women's health, we are specifically trained to treat and assess the pelvic floor muscles. So we treat those muscles the same way we would treat any other muscle, but we're just specifically trained to treat those muscles. I
actually ran into a physical therapist at CSM last year. Yeah. And she was talking about the idea of changing women's health PT, like the name, into pelvic health physical therapy.
Yeah.
And what do you think about that? Because you kind of mentioned that you see both women and men.
Right.
So I think it's probably more beneficial to patients that they won't feel like, oh, women's health is only for women.
Right, yeah, absolutely. I think that pelvic floor physical therapy better describes like what we're doing, because we do see a lot of men and for a lot of the same issues. So incontinence, pelvic pain, sexual dysfunction, so we see a lot of men too.
Okay. Okay, so everyone hears of pelvic floor at some point in their lives. It's either they're private trainers in the gym or whatever, and they always emphasize the importance of pelvic floor. So can you tell us more about what is pelvic floor?
Yeah, so your pelvic floor muscles span the bottom of your pelvis. They run like a hammock between your pubic bone and your sacrum, and they play a lot of different roles. So they act as a supportive role to your organs. So they work to support your bowel, bladder, and reproductive organs. They play a role in sexual function, and they also play a role in your conscious control of your bowel and bladder. So those are its main functions.
Okay. Okay, the next question is, who should see a pelvic floor physical therapist?
Right, so anyone with pelvic floor dysfunctions that include urinary incontinence, urgency. We see people with urinary retention, sexual dysfunction, pelvic pain, constipation, and then we see a lot of patients who are pregnant or postpartum having a lot of those issues. So pelvic floor issues can also refer pain to the low back and hip. So if you're having persistent low back or hip pain, it could also be worth looking into pelvic floor therapy as well.
I have a friend, she's from Taiwan, and she actually had a C-section for her first kid. And after 6 months or a year of her pregnancy, she's like, the scar seems to be really tight, and she's kind of afraid to like do anything around that area and feel that that area is just not herself after she gave birth.
Yeah.
So is that something that if people have that kind of issue that they can go to you?
Absolutely. We see a lot of that too, and we treat a lot of scars. We do a lot of soft tissue work with scars, and
But that's
and a lot of
something-
times, like when you have a C-section and you have a scar like that, if it's adhesive, like if it's not moving well, it can affect the bladder too, because it's so close to the bladder. So sometimes you can have some urinary urgency or frequency with those scars too. So it's important to do that soft tissue work in order to loosen up the scar and make sure everything's moving correctly.
Okay.
And yeah, so patients can also have diastasis after procedures like that. So we also do a lot of strengthening of the abdomen too.
Okay. They're talking about how in Europe, 70% of the women, postpartum women, that they are receiving any kind of physical therapy.
Yeah, I think that should definitely be a norm.
Okay.
It'd be very helpful to do afterwards, just to get yourself back on track faster. And
in general people should do any exercise to strengthen their pelvic floors, or is it more for people that they've already had some symptoms and they should start doing those?
I'd say if you're symptomatic, then it's important to know.
The reason why I asked that is because there's some classes, I don't know about here, but I know there's classes back home that they, in the gym, that they put out and they're like, oh, pelvic floor is so important for blah, 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 and you should come to this class and we'll show you how to activate your pelvic floor. But do you think it's something that people should advertise it as a gym class?
They could, absolutely. I think if someone is symptomatic with any kind of pelvic floor issue, it's important to see a pelvic floor therapist before you do any of that kind of stuff, because if you have pelvic floor spasm, you don't want to be doing strengthening exercises because that can make it worse. So if you're symptomatic, I'd say no, you should probably see a therapist before you do any of that kind of stuff. But if not, yeah, it doesn't hurt.
Okay, that's cool. It's just like general strengthening, conditioning kind of program.
Right, yeah.
Okay. Thank you so much for sharing your knowledge of pelvic floor physical therapy, and I think it is very beneficial for either patients or physical therapists that we know more about different domain of physical therapy, and then we can either, when the patient has the symptoms, they know where to go to, or for physical therapists that we know that, oh, maybe we can refer our patients to pelvic floor physical therapists for a better treatment for our patients. So thank you so much.
Absolutely. Thank you for having me.
Yeah, and thank you so much for watching AliceThePT. We'll see you next time. Bye.
Bye.